everyone, and welcome to part 2 of chapter 8. Where we left off, we were discussing biological approaches to treating unipolar depression. So we were looking at that body physiology, we're looking at our chemistry of our bodies and the actual physiological components, brain structures, circuits, and how those lend themselves to the development of depression and how we can use them to help treat it. So this was just a refresher slide, so let me proceed. So how do these treatments compare? Because we talked about CBT, we talked about multicultural or sociocultural treatments, as well as biological. So which one's the best? Well, again, we're asking this question if we think back way to chapter 1. We have to say, which treatment is the best for what person, what disorder, at what time, and at what kind of dose, right? Because depression treatments, biological treatments, for example, will have quick results. So as you can see here, drug therapy has quicker relief, number 2, right? But in the effectiveness long term, they're both going to even out, right? Because drug therapy is going to give you quicker relief, but the talk therapy and different types of psychotherapy are going to have similar effects. They just take a longer span of time. CBT, interpersonal, and biological therapies are all effective treatments. What we found is that combining these psychotherapies along with drug therapies works really well, and it actually works better than just any one type of treatment. If you think about it, kind of makes sense that we're going to use the drug therapy to help give someone quick relief if it works, right, to give them the little tools they need to kind of be able to focus on the therapeutic aspects. So I had a therapist back in the day who told me that when you take a drug therapy, it's kind of like little floaties in a pool, right? You're swimming, you might be struggling a little bit, but these little floaties, they're going to help you. They're not necessarily going to heal all aspects because you still have to learn to swim. And so that's what we're thinking about here. The drug therapy is going to give us the floaties to feel better. We're comfortable in our pool. But we also have to learn how to swim, and that psychotherapy, their talk therapy, different methods are going to help with kind of emphasizing the skills we need to combat those cognitions, right? So then that way, if someone's drug their body gets used to it or doesn't work effectively as it used to, they can use those talk therapy approaches to help themselves, right? And it's not saying one's the easy way out and one's the other, but they both work really well together and in tandem. And when we're talking about the brain stimulation techniques, we're just saying that ECT is going to be more effective at treating depressive symptoms than other brain stimulation approaches or antidepressants. Again, it's going to be fast-acting, and it's intense, and it is often only suggested for severe cases of depression. I just wanted to pose this question to you all because it was in your text, and I thought this was a great question to think about. So, we're talking about recurrences of depression. Depression tends to recur more quickly in people who are treated by drug therapy alone as opposed to behavioral therapy. So why might depression treated by cognitive behavioral therapy be less likely to recur or come back than depression treated by antidepressant drugs? I want you to think about this. It has something to do with what I talked about with the little floaties. Should I give you the answer now? Oh wait, I'll see what you think. But reference my little floaty analogy, and that's how you know. Because think about it. When you have those cognitive behavioral skills, you have the skills yourself to combat those situations you're facing. You're not just reliant on the drug itself. So it's good to have both. Treatments for bipolar disorders, one of the biggest things we've seen is lithium. Lithium and mood stabilizers. It's to kind of help with kind of not switching between such extremes on that spectrum. So we're helping to stabilize those moods of people with bipolar disorder. So sometimes, it helps them out of the depression. If they're on antidepressants, and the mood stabilizers kind of decrease that mania. How they work, how lithium works exactly in mood stabilizers is not fully understood. And that's why I think it's important to emphasize, because even though that seems a little like, oh, then why are we using it? right? Do the ends justify the means? And how can we, it's an ever-evolving science that we're trying to uncover. But I've included Dr. Tracy Marks again. I found her channel and I was like, wow, this is awesome. So she's a psychiatrist. And the difference between a clinical psychologist and a psychiatrist is a psychiatrist went to med school. Okay, so they are a medical doctor. And so they look at a lot of they may use therapeutic approaches that are psychologically based, but they also focus a lot on that biological approach to different psychological disorders. So she has a really good video about the good and bad of lithium, and I thought it was just something interesting to supplement our readings concerning bipolar disorders. But one thing we're also going to look at with bipolar disorders is adjunctive therapy, so using it alongside of our drugs of choice. Because people with bipolar disorder, whichever kind, tend to stop taking their meds sometimes. And this is because they could be bothered by the drug's effects. And that happens to, think of a lot of people. Like, this is not shaming people with bipolar disorder. Think of you. Your doctor tells you to finish your antibiotic. Like, they say, oh, you have to take this for 14 days. You have to finish all of it. And then you feel better and you're like on the 9th day and you're like, do I really have to finish all of this? It's kind of like the same thing. Be a good patient. Take your meds. Right? But individuals will stop taking their drugs because they're bothered by the effects. They feel too well to recognize the need for the drugs. They miss the euphoria felt in those manic episodes, right? Because in the manic episodes, they were so productive. They had such this high kind of life feeling, and now it's gone. So it's kind of bringing them back to a normal range, and they don't necessarily enjoy it. So psychotherapy works well to adjunct those mood stabilizing drugs so that we can, keep someone on track to keep taking their meds for the bipolar disorder. And again, social support is always needed. And it reduces the chances of hospitalizations and improves their social functioning. So it's kind of like having them take the drug, but also kind of working with them to see how it progresses and how they're handling themselves. In the last slide, with success comes new questions. We're just looking at, kind of like, I think you may have noticed, the treatments for depression were so vast. And there's a whole, mixture of matrices we could apply to figure out which one would work best for people. But the treatments for bipolar disorder is narrow and it seems a little, oversimplified, right? Okay, mood stabilizers, lithium, and therapy, right? Unipolar depression is more varied and complex, but no less promising. They're both very promising types of treatment, despite the fact that 40% of people with mood disorders do not improve under treatment. That is a large number. So this emphasizes the need to continue the research and to understand depression, where else we can go with it, right? Because sometimes I feel like when we're reading about these disorders in the text, we kind of think, okay, we have all the information we need, let's just treat the people. Unfortunately, it's ever-evolving, ever-changing. We have new symptoms developing, and we have to be sure, how can we treat more people? That is quite a large number, okay, of people who do not improve under treatment. So I can't imagine the amount of people who are just going through life suffering the symptoms thinking that's part of the norm. So it's very important to continue to research these topics. But the treatment for people with depression is very promising, despite that number. Please remember to take exam 2. And as always, ask me if you have any questions, and have a great week.